there at HHS now for, I think, about a year and a half, almost a year and change. Tell us what's cooking over there in regards to your top line activities.
Yeah, it's been interesting. Yeah, coming up on a year and a half. And I think I don't know that I said it last year when I was on the panel here with you and Tom Trezza and everybody, but I came on talking about data, and I'm going to tell you nothing has changed in that respect since I got here. You're going to hear me talk a lot about the data.
Sure.
So let me give you a few things that have been going on there that are exciting in that area that are going to make us deliver better healthcare. For one example, we've developed a framework for expediting data sharing between the Department of Health and Human Services and the VA. In May of 2023, we assigned an agreement with the Department of Veteran Affairs so that we can share data with them, basic terms and conditions. We set this up so that we could protect that data. We could use data that's non-public. This has been normally a very complicated, extended process for when we want to share information. Well, we've created this framework now where we can expedite that to make sure that we can share, public health data, patient care data, health care quality information, assistance, surveillance, analysis, prediction, response to existing emerging health concerns, things like that in a more agile way. So right now we have, using this framework, the CDC is working with Veterans Affairs on that, but we're looking to add other organizations to it over time so that we can continue that expedited ability to share data. We only need to look back a couple of years to the COVID crisis to understand why that agility is needed. So that's the good news. We're really moving forward on our ability within the government to share data, and that's happened within the last few months. There's also another capability we put out in terms of data is, and this is not a new one, it's been there for a while, but it's not well known. But if you go to healthdata.gov, that's the official site for HHS to share open data with the community. And so we share internally amongst ourselves, our operating divisions like CDC, FDA, National Institutes of Health, but also these are available to the public. And so the reason we make these available are for those hospitals that may need them, researchers who may want them at universities or at other facilities. So sitting out there are 12,000 data sets. It's a well-utilized platform. They've had over 12.5 million visits since the beginning of this year. So it's another asset out there that's available to the public that we keep updated. Related to that, we've also launched an internal capability called HHS Connect. And this is so that internally within HHS, which is a very large department, that we can share data amongst ourselves. So our internal employees can request information and we publish information to it, and we share that information internally because it's such a large amount. That's going to be our go-to catalog for where you can go and say, okay, where is this data located? And it'll literally, thus the name HHS Connect, it connects you to that data source so that you can request it and then use it. So that'll help us amongst ourselves within HHS to be more efficient at using our data.
It's certainly all about